Oops, that one, we can pick that up in a minute. Okay, thank you everybody and welcome. We're ready to start the meeting, and I'm Hattie Davis and I chair the Trust. It's really good to see quite a significant number of you here in the room, but also more of you here virtually over there on the screen. And all of you will have a good chance to ask questions towards the end. But beginning with, that is a huge thank you. And that is a huge thank you to all of you for the amazing job that you do in actually working for the health of our patients and our local population. I know it's really tough times, and I have no doubt we'll come back to that when Lance talks in a few minutes. But you are amazing. You genuinely are amazing. I'd also like to say thank you for taking the time out of your day to come today. It's really nice that you've come. And I hope you're going to ask lots of really tough questions and put all the exec team on the spot. They're sitting there ready for you, pointing at each other as to who's going to answer the question when. You probably know it's my first year as chair here. I've done just over a year, by a couple of days, something like that. I wanted to begin by just saying a massive thank you for making me feel so welcome. I came here because when I potted around before my interviews, you were a fabulous bunch of people to know. You were all friendly, you were all welcoming, you all picked on the poor idiot who looked lost wandering around in the corridors and pointed her in the right direction. And that's why I came, because actually I think if you begin with people, the rest falls into place. So it's been really good. And I've really enjoyed and served my non-exec colleagues, and I'm going to upset them and point them out. There are 4 in the room and several on the screen. So Helen Howe, waving at you. Liz Baker, waving at you. George Wood, waving at you. Colin McCready, waving as well. I think I've picked up all the ones in the room. So, Rob, sorry Rob, I missed you. I apologise. Rob Gerlis also. So, we've had the chance over the last year, since the lockdown ended, of actually coming out and meeting lots of you. We've done a lot of walkabouts organised by Shahid over there. We've come and met people, learned lots about what you're doing, and lots more of that to come. But if any of you want visits, just ask. We're always happy to come and visit whoever you want. Either grab Shahid or grab me or grab anyone else. And we've also brought with us Anne Nutt, who's the chair of the patient panel. More from her. I know she's got some questions in a little bit. We brought Anne with us as well now. So it's been really important that we've had that chance to actually get to know people and understand what the Trust does more. We're always around on the induction days, the very exciting new system induction days. And there's always a Ned at all of those. So we're often around wandering around in the corridors. Now you know what this lot look like. Stop them and ask them questions. So what's really hit me in the first year? Lots of things have hit me in the first year. The first of which is that actually I'm really proud of the work you do, the hard work you do. You keep going no matter what the world throws at you. Yet another lockdown, yet another spate of COVID, yet another bit of cost of living crisis, all of those things. And you lot just keep going, and that's amazing, and you should all be really proud of that. You also show magnificent compassion to our patients, care, compassion, support, and actually affection. All of those things shine through. We did a visit to Harvey Ward the other day, and the compassion and care and affection being shown by the staff to the patients there was just fantastic. So thank you for that as well. And really important, you have a really strong commitment to making it better. And that's what drives all of us, I suspect, as we move forward. So, what are we doing next? We're building on those improvements. If you look at all of the figures and statistics that we look at in every board meeting, we know that things are improving. We also know that we need your help and your support to make sure that happens. You all individually know more about the organisation and your workload and your team than we ever will. So tell us your ideas, share your ideas, let us know what it is your experience of working here is. We know that there will be challenges as we move forward. We know that we've been backwards and forwards on the new hospital programme more times than any of us care to remember, and again, more from Lance on that in a little bit. We know that we need to grow our integration, and having forgotten Rob, I now have to offer him a double apology. Rob has been the chair of the CCG and the place for more years than he cares to remember, although he originally trained here, didn't you, Rob? But actually working across the integration with our system, with our local communities, all of those things, really important. And the last bit on there, you won't be surprised to know, supporting each other. We know there's going to be a recession. We know the cost of living is going to hit every single one of us. We know that our population is going to be hit probably even harder than most of us. And so actually our support, our well-being, keeping ourselves well, happy, supported and caring for each other, using resilience, all of those things, absolutely fundamental. And through Getch's work, we will build that in as we move forwards. So, once again, from me, a massive thank you to everyone for everything that you do. And that's me done in terms of the formal bit of this AGM, but I'll come back and answer questions later on. I'm going to pass to Lance.
Thanks very much, Hattie, and hello, welcome. For those of you who don't know me, my name's Lance McCarthy, Chief Executive, and I've got the absolute pleasure and privilege of talking through and reviewing the last financial year, 2021-2022. So when I stood up here this time last year reviewing 2021, I described it as a year like no other. And I really didn't think at that time that 21-22 would be such an extraordinary year and such a difficult year, given what you and all of our colleagues, both at PAH and in the Border Health and Care System, had gone through the previous year. And I couldn't think of a better way of describing 2021-22 as another year like no other, which it truly was. So we've now had two of them, so I'm not quite sure what's in store for the rest of this year and what I'll be saying in 12 months' time. But 21-22 was really genuinely another extraordinary year for so many reasons, dominated again by the COVID-19 pandemic, and I'll talk a little bit more about that, as well as a number of CQC inspections we had. So a total of 5 CQC inspections at the back end of 2021 all the way through the first 6 months. But despite that, I'm also going to talk about the extraordinary amount of fantastic change that you and colleagues have put in across the organisation, with the patients right at the heart and right at the centre of all that we do, with change in almost every single specialty and service line that's really continuing to enhance and improve the care that we deliver. A huge number of colleagues who've been recognised for national awards, local awards, regional awards, and I'll also talk a little bit more about our partnership working and the ongoing investment that we've made in the organisation. So COVID-19 and the impact. So the bar chart at the bottom shows the number of COVID positive inpatients that we've treated over the course of time. You can see the green block for the financial year 21-22, which is the review of this year, and how that compared to the previous year, 2021. So last year we tested more than 20,000 patients coming into the hospital for COVID. We treated nearly 1,400 known COVID positive patients, and unfortunately we had 148 patients who died with COVID, or who died having been COVID positive. Although fortunately that number, both in terms of absolute terms and relative terms, was obviously a much lower number than in 2021, thanks to all the fantastic changes in treatments and the way that we're diagnosing, the way that we're treating all of our patients, but also obviously the positive benefit that the vaccination programme has given us all. You can see if this pointer works. No, not not sure. The impact as well of the new variant that came around about Christmas time last year, Omicron. You can see the big spike in that, and you can see the ongoing impact that that has had in terms of the management of COVID positive patients in the organisation. And in fact, in the first 6 months of this year, we've already had more COVID positive patients than we'd had in the first 6 months of last year, 21-22. So maybe 22-23 will be the third year like no other, certainly from a COVID number. But what it does really importantly show and underline is the significant ongoing pressure that we've been on as an organisation, that all of our colleagues have been on trying to manage those patients safely and effectively, and constantly chopping and changing what we're doing, constantly evolving the development of our services, constantly changing the way that we work in the teams that we're working in so that we can best enhance the care for the patients, and that takes its toll. We also had in the sort of purple block there between February and August last year, 5 formal CQC inspections, 2 into our emergency department, 1 into maternity, 1 across medicine, and a well-led inspection, and I'll talk about those as well. Just a little bit more on COVID-19 because it did have such a big impact, but I just want to say an enormous thank you to everyone in this room and to all of our colleagues outside the organisation, everyone on the screen, for the continued amazing, genuinely amazing ongoing response to the management of COVID. And that's actually not just PAH colleagues, it's all of our colleagues in the local health and care system and the local authorities where we've worked extremely well together to really transform how we're providing the care for our patients. I've talked or mentioned a little bit about reorganising the hospital. We've literally reorganised the geography of the hospital over and over again, changed the way people are working in teams, changed the makeup of teams, created, developed new roles, all of which has been fantastic for our patients, but does put a huge pressure on everybody. And that has led to really significant impact that we all know that we're all experiencing and feeling on both our physical and our mental health and well-being. And for 2.5 years of trying to manage that, really does take its toll, as you will all know, and all of your colleagues will know. Also, a huge shout out and massive thanks to the team that coordinated all of our vaccinations here. So we've vaccinated nearly 10,000 people, provided nearly 10,000 vaccinations for our people over the course of the 2 vaccinations and the booster, and are just about to set up the local vaccination hub here over the next couple of weeks for the autumn booster as well. So supporting our colleagues and enabling all of us to get early vaccinations and to remain as safe as we possibly can, so we can continue to provide care for those that most need it. Obviously, and I think it goes without saying, and we all know the impact that COVID has had on us personally. We know the impact that it's had on our colleagues as well. But it's also led to obviously a very significant impact on our patients. So we've had to cancel over the course of the last 18 months, 2 years, a significant amount of elective activity. We know that it's had a really big impact on access to diagnostic services and access to cancer services as well. And we know that we're not in the place that we would like to be in terms of speedy access to all of our services. The team have done an amazing job over the last 6 months in particular at making sure that we can get those access targets down and back to where we would all want them to be for us and for our families and for our local populations. We've now eliminated all patients waiting more than 104 weeks. We've got just over 250 patients now waiting more than 78 weeks, and we've got about 1,800 patients who are now waiting more than a year, which is a lot of patients, or are a lot of patients, and the team are working extremely hard to bring all of those wait times down. But compared to where we were 6 months ago, that's a fantastic achievement. And our cancer targets are coming down. Our diagnostics is we are now diagnosing and scanning more patients than we were pre-pandemic, thanks to all the hard work of imaging teams and our pathology teams as well. So we're starting to catch up, and we're starting to get back to providing the services and the access times that we would want to for our patients. But it will take us a number of years to really get back to where we were pre-pandemic. Just a little bit about CQC inspections. So as I was saying, we had 5 over the course of 21-22 across a whole range of different services. You can see that's our latest scorecard. You can see the black lines, the black arrows. The CQC represents any changes in the rating for either the domain or the service with an up arrow, a down arrow, or a sideways arrow. So you can see all of the services that were inspected when our latest report came out in November, and you can see in every single box there all of the arrows pointing at each other on a level line, meaning that none of those ratings changed. So obviously, on the one hand, all of the hard work and the energy and the effort and our drive to be outstanding in all that we do, then we would want to have seen some of those arrows pointing upwards. Having said that, given the pressure we've been under, given the context I've just talked through with COVID, given the impact on our patients and our colleagues, actually, I think to have had no change in any ratings at all is a testament to the hard work of everybody in the organisation, and is an achievement in itself, and actually bucks the trend of most other hospitals who've had a CQC inspection over the last 18 months, where the majority have either had a service or the whole organisation see a reduction or decline in at least one of their ratings. You can see that caring from the CQC's perspective still remains good in every single area other than children and young people, where they've rated it as outstanding, which is fantastic, and I think is testament to everybody in the organisation. But I think and hope that everybody in the room would agree that is how all of our colleagues work collaboratively together and really well to put the patient right at the centre and ensure care and compassion fundamentally is provided 24/7. We do, having said all of that, still remain with an inadequate rating in the safe domain and the well-led domain for urgent and emergency care service, and we have a formal Section 31 improvement notice from the CQC, and the urgent and emergency care services teams have been working extremely hard over the last 9 to 12 months or so to really put in place everything we possibly can to remove that improvement notice. And I'll talk a bit more about modernisation and digital and technology in a minute, but one of the key drivers around that is not only focus on the patients, the ways of working, how do we triage and assess patients early, how do we improve our clinical risk assessments. On top of all of that and managing the demand for urgent care services, the team have also put in place a new IT solution called Nerve Centre to really help with the management of that, to help with the management of patient information and help with some of the clinical decision making. So we're making extremely good progress to improve the experience and the safety of our patients who need our urgent and emergency care services. Just highlighting some of the key numbers from my perspective over 21-22. So despite the COVID pressures, despite the CQC pressures, etc., team, we still saw more patients than we'd ever seen in the emergency department. I think the highest figure before was 112,000 2 years ago. So almost 10% more patients than we'd ever seen demanding or having a need for our urgent emergency care services. We also continued to see a huge number of outpatient attendances, and thanks to, again, some really fantastically speedy innovation, some use of technology, and our clinicians thinking outside the box and working in a very different way. We provided in 21-22 nearly 20% of all of our outpatient appointments virtually, so enabling patients to get access to their outpatient attendance without having to come onto site if they were maybe anxious about that, improving the efficiency and effectiveness, but ensuring that we can still continue to provide that really good access for as many patients as possible. And in fact, that number I think is about 27-28%. Yeah, Jim's nodding. 27-28% now. So we're continuing to develop that and continuing to offer our patients multiple ways of being able to access the services effectively. We also invested significantly in terms of our workforce, and I'll talk a little bit more about some of the other things that we've invested in for our workforce, but we created nearly 5% more additional posts, properly established additional posts, 176 additional posts over the course of the year. So we have nearly 4,000 whole-time equivalents in the organisation, and that's a really significant investment in staff of all professions and all grades. There's quite a lot of nurses in there. There's a significant investment in midwifery, and there's some really significant investment in some specialties at consultant level to make sure that we can continue to provide the quality of services that we want consistently for all of our patients. and Tom will talk in a minute about the money. I also wanted to highlight some of the phenomenal developments to our services across the course of the years. As I was saying earlier, I don't think there's a single specialty or subspecialty or department that hasn't really genuinely changed and transformed a chunk of what it's doing for the benefit of our patients. But I just wanted to highlight a few there to show you the breadth and the depth of some of the service development. So that is not by any stretch of the imagination the size and scale of all of the changes that teams have made. At the top, a huge amount of really, really good integrated work in with primary care, with our community services and with our social care colleagues to support our frail older patients in a much, much more effective manner. Some really fantastic working with the ambulance service as well, working through Janice and working through the OPEL department. I was talking a little bit earlier about use of technology, but we've invested heavily and everyone's been extremely open-minded about using tech in a very different way, supporting patients, for example, in terms of our chemotherapy prescribing, being able to manage and share healthcare records better between all of our health and social care providers. Virtual outpatient appointments, as I was talking about, the virtual ward capacity, again, fantastic example of both modernising our services, using digital and technology, but also integrating them effectively with our other health and social care partners so that we can manage patients as safely as possible in the best environment for them, which is in most instances not in an acute hospital setting, and enabling us to have the right capacity in the acute hospital setting to care for those who really, really need our acute skills and expertise. Over the course of COVID, we also, a huge thanks to our amazing volunteers and team who put in our virtual visiting service. And again, great use of digital, great use of technology, great use of modernising our services, but absolutely fantastic patient at heart demonstration about how our relatives can talk to their loved ones while they're in hospital, either because we put some visiting restrictions in place to prevent them from coming onto site, or relatives were genuinely nervous and anxious and worried about coming onto the site. Fantastic. It's won loads of awards. A huge amount of energy and effort and dedication gone into that from a huge amount of colleagues. And then supporting our urgent care and our flow, lots of work around, again, integrated care with GP and GP provider services to really enhance our urgent treatment centre provision as well. I've mentioned briefly how proud I am of all of our colleagues, and this is a few of our amazing colleagues who have won either national awards or were shortlisted for national awards over the course of the year. Again, you can see a massive range of specialties, a massive range of professions, a massive range of grades of colleagues, so it shows the breadth and depth of the energy and the innovation and the passion and the compassion that we have of colleagues across the whole organisation. And the photos there on the right of Alison, Donna and Ashraf, who's also got very proudly shown everyone and will continue to, I'm sure, his video of him collecting his MBE. But an amazing achievement from a whole range of people there. And I've also put on the Queen's Award for the voluntary services as well for our patient panel. So whilst actually they received that in 2021, we didn't actually, were awarded it in 21, didn't actually receive the award until 21-22. But you can see the breadth from both our patient panel all the way through to some of our more senior clinicians, just the extraordinary amount of energy that goes into continuing to develop our services for our patients. And we continue to invest. So despite that, despite the pressures, despite how everyone's feeling and the anxiety that people are carrying with them on a daily basis, we continue to invest heavily in both our people and our places. So as part of, and I'll talk about it briefly in a second, PHT 2030, which is our 10-year strategy, we're continuing to invest to modernise our services, to integrate our services, and to make sure that we have the workforce that is in the best place to be able to deliver the services that we need, but also to make this the best place to work in the NHS so that people will come and want to be here and have the opportunity to continue to develop their careers and be looked after. So I just want to say a huge thank you as well while I'm here to our staff health and wellbeing team, to our people team, and to colleagues who are on the health and wellbeing steering group as well for all their ideas and energy and passion. We've put in a phenomenal amount of support for all colleagues to really support both their physical and their mental health and wellbeing, and I know there's many more ideas coming down the line as well. So we've put on some absolutely fantastic staff engagement events, and I was just talking to the sound team earlier who were here, who helped us out with This Is Us Week, and their personal reflections, which were absolutely fantastic and lovely to hear, given that I couldn't be in the room because I had COVID at the time, but it got so much positive feedback from colleagues. So again, a huge thank you to everybody who put that on, a huge thank you to everyone who was part of it. But that linked into the staff award ceremonies, and the recognition and the engagement has been absolutely fantastic. But importantly, we've also now got some really fantastic leadership development programs in place and are continuing to develop those to support all of our colleagues in being the best that they can be, for PAH to be a place where you can come and you can work and you can progress your career, but really importantly for our patients as well, all of that energy and time and dedication to training and development ends up in us delivering better care, better outcomes and better experiences for our patients. Tom will talk a little bit about the capital in a minute, so I won't spend too long on that, but you can see, £26 million worth of investment in 12 months. That's a lot of investment, and that's focused in 4 areas predominantly, that to really help and drive and improve the physical facilities that our patients receive care in, to really support our colleagues. So we've got the Alex Lounge, which is an absolutely fabulous space now to be able to rest and relax, take 10 minutes, 15 minutes off out of a busy shift and just have a cup of coffee and just get a little bit of downtime. Or this amazing space here, Learning and Education Centre, really here to again link in with the leadership development and link in with support to really enable people to enhance their careers whilst they're here. A huge amount of work as ever, and investment as ever in the critical infrastructure and just making sure we're keeping our buildings safe and ticking over, and then a lot of energy and effort and time and money going into digital and technology so that we can really modernise our services, increase our efficiency and improve our outcomes and experiences for our patients. Briefly, a quick look ahead. So I mentioned PHT 2030, which is our 10-year strategy with the roundel on the right-hand side showing the 5 priority areas that we're really focusing on. We do, however, have an absolutely immediate short-term need and focus, and have had for a number of months, around continuing to recover our services from COVID. We've got an absolute responsibility to our patients to try to get those access times down as quickly as we possibly can. Continuing to drive the fantastic changes that have happened in the emergency department and urgent and emergency care services, but continuing to drive those so that we can respond to the ever-increasing demand for urgent care for our patients. Winter is looming, it is coming, and nobody's expecting winter to be straightforward this year. We think it's going to be a difficult winter, so a lot of focus and immediate energy about how do we make sure we're in the right place as an organisation to manage our patients over the course of winter, and then obviously the work to continue to support the physical and the mental health and well-being of all of our colleagues. We couldn't do it though, and we couldn't do it if it wasn't underpinned by working in a very, very different way with all of our health and social care colleagues and local authority colleagues, both within the local system, the West Essex Health and Care Partnership, and the slightly broader system that we work in, the Herts and West Essex Integrated Care System. We've had I touched on some of them, but with some really fantastic new models of care and genuine integrated care where clinicians are working in a very different way with each other, enhancing pathways, reducing handoffs and trade-offs, and really starting to work across different geographical boundaries with the patient right at the heart and the centre, and making sure we're providing the right care for the right patient in the best setting. And there'll be a lot more of that to come as we continue on our integration journey. And then, of course, the new hospital and the work that continues on the new hospital, and the drive and our absolute passion for that, and making sure that we can provide into the future the really high class, top quality, outstanding physical environment for our patients to receive their care. And then all of the work that has happened around the electronic health record, where we are very, very, very close to signing off our full business case for the electronic health record, with a huge amount of investment from the national team in that as well, so that we can really enhance the way that we capture data and then manage our patients effectively. So a lot on, and a lot of work to do over the next 12 to 18 months or so, but to continue the drive for us to provide outstanding care through modernising all that we do and integrating all that we do with our partners. And why are we doing it? I think everybody knows that, everyone understands that intuitively, but that's why we're doing it, to really continue to improve the facilities, the care, the outcomes, the experiences that our patients get, but also, really importantly, for our colleagues to be in the best place possible, in the best mindset possible, to be able to provide that best care with the best opportunities that colleagues can get in the NHS to develop and enhance their careers. So finally, I wanted to say, in the same way Hattie had said, a big, huge thank you, I think it was. I wanted to say a massive, massive thank you as well from me, but from all of my exec colleagues and from all of my non-exec colleagues who sit on the board. Massive thank you to our patients and to their relatives, particularly for being so understanding about the visiting restrictions that we put in place for many, many months, and the impact that had. A huge thanks to our local community. They've been amazingly helpful, responsive, supportive at all times, everybody in the community. Massive thanks to our health and social care colleagues from outside of PAH. We can't work and can't provide the care that we want to provide if we do it in isolation, but our colleagues have worked with us tremendously well, and hopefully they would say that we've worked with them tremendously well to really continue to improve and enhance and develop integrated pathways for the benefit of our patients. And a massive thank you to all of our fundraisers. So we've seen some really significant increase in fundraising events, thank you very much, and in donations through our charity over the last 18 months as well. And I know that none of those events go without a considerable amount of energy and effort to prep them. But we've had all sorts of things from orchestras through to running events, through to all sorts of things. So, but a massive thank you to everybody who's raised money for us. But above all, I just wanted to say a huge thank you to everybody who works in the organisation, everybody who comes to PAH, both those employed and salaried, but also to our volunteers, who I think everyone would agree are absolutely phenomenal and provide so much energy and effort for free to support us and to support our patients. And a massive thank you to the patient panel as well for all that you do, the challenge that you put in, but the focus that you have on the patients. And thank you for everything you've done for 21, 22, and thank you going forward. And thank you for your time today.
Thanks. Hopefully that's working okay. So my name's Tom Burton. I'm the Director of Finance here at the Trust, and I've been here for just over 4 months. Joined initially as an interim, and then been really lucky enough to be able to stay here permanently. And it's an amazing trust, to echo everything Lance and Hattie said, and an amazing place to work and be, and you see an amazing amount of effort and endeavour and care that goes into everything that we do. Traditionally, the finance section, I always make this joke with most of my colleagues, but finance never is the thing most people get most excited about. But knowing a few of my NED colleagues in here today are accountants as well, it's what really we love a spreadsheet. So it's really good to talk to you a bit and show you a graph or two. But it's probably worth just remembering just quite how unprecedented the financial environment has been. So the NHS, if nothing else, it's been around a very long time. We've kind of got a long rhythm of what we've been used to. And when the pandemic hit, something you probably wouldn't all appreciate is just how significantly the financial environment changed. And we've been hugely well supported, I think, from government funding for a lot of what we wanted to do. And suddenly, there's never enough money for everything. But suddenly during COVID, there's been more money than we've probably been used to, and available in very short-term kind of reactive ways that we've had to utilise. And I think the Trust's been particularly innovative about the way we've been doing that over the last couple of years. We've got these. I'll try and explain some of the terminology because we do love to try and confuse things in finance. But once upon a time, we had this thing called a control total. So it wasn't ever about just trying to break even. You were kind of given a target to aim at, and that's still there. But because of the money that has been received, everyone is expected to break even in the future as a minimum. Capital dictates how much money we can spend on the great initiatives Lance alluded to, the buildings and the infrastructure that we have. And then we're very much held accountable for that by having to work in this new thing of being a system. So we are part of the Herts and West Essex system. And whereas before we were only kind of required to just look after ourselves, we're now part of every other organisation in the environment in which we work. So it's not just about us achieving financial balance, it's about everyone in the system achieving financial balance. In terms of the financial performance over the last couple of years, it's a couple of stark things I wanted to pull out here in that when the pandemic hit, so in 2020-21, we were given quite an uplift in our income. So you can kind of see that top figure, top right, was 315 million. That was up about 30 million from the year before. And then last year, as we kind of acquired money for COVID recovery, maintaining our ongoing COVID spend, etc., it went up significantly again. Now this year, that trajectory is going back down again. So we've had a lot of investment, we've had a lot of money to do what we needed to react to COVID. The general expectation is that we'll have to cut our cloth a little cleaner and we'll have to return to some of the older worlds that we had to before. But overall, the big takeaway is we achieved exactly what was asked of us. We made a small surplus. We were expected to make a break-even target. I achieved 0. And as the bottom figure on the bottom left shows, we were actually £1.3 million in surplus last year, which is really good. Trouble is, this year we've got to do it again, and the next year we'll have to do it again. And as I say, the environment is becoming more and more challenging in which to do that. The vast majority of our income comes in from this. It's obviously the blue area that you can see comes from our commissioners. So again, that's now system is kind of the same thing, but we used to get paid according to the number of patients that we saw. That's kind of been aggregated, so we get what's called a block amount of money. So the vast majority of what we get is set at the start of the year. And whereas before we used to have to operate in an environment which was called payment by results, where it was basically governed by how much activity you did, governed how much money you had, it's now kind of set at the start of the year. And because of all the fluctuation we've had in the last couple of years, we've got to understand what that means for us. Are we delivering services in the same way? Is that in the right area for where we want to spend some of that money? And the vast majority else of the other elements that are in there, just if I call a couple out, NHS England means our specialist work, so the less sort of BAU, some of our cancer work exactly. We get some money directly for training and putting towards our staff, both medics and nursing and AHPs. And as the sort of reimbursement and top up, that's some of the technical money that we've been given for the year ahead. So this, if we look ahead another year, it looks different again, but you can see the vast majority is for providing NHS work. As I say, last year we had £355 million. We've got about £20 million less roughly this year. And what's interesting about this as it was presented was just how equally it's spread across a number of clinical services. So the big clinical services like surgery, medicine, family and women's, some are bigger than others, but largely we've got a fairly even distribution of how we spend our money over the year. And that's largely rolled forward again into the current year. Few headlines in there. Now this is the point that Lance was talking about. So capital, just for those who aren't familiar with financial speak, our revenue budget is what we spend day to day, and our capital budget is what we spend on things, big things. And some of the highlights that are alluded to here is this incredible learning and education centre. It's wonderful, it's new, it's bright, it's got nice high ceilings, etc. Really nice things in which to have a good learning environment and a great facility for everybody. We've had the Alex Lounge, which was alluded to, a real indictment of the investment in our staff, and it's one where we were really lucky to also attract significant charity funding to help support as well. So it really shows the partnership in which we're trying to work and invest in some of our infrastructure. ICT is that thing that everyone sort of takes for granted when it's there, but to make this new agile working environment happen and the amazing fact that we're managing to broadcast via Teams and do all of this and have people dial in is all thanks to the hard work of the IT department. But that is becoming ever harder, to sort of invest in, and there's more and more demands on it. And we're about to really transform the way we do that with our EHR business case, our big electronic healthcare record. So a lot of work is going in to justifying that and making the case nationally for why we should get this world-class service, which I'm sure we would all see the benefit of. And then a few other, we've been trying to invest in our existing estate, a point that Lance alluded to. We've got this huge vision for PHT 2030 and investing in a new hospital, but we've got to keep this hospital going in the meantime, and that requires significant investment in a number of areas to make sure we can still do that. So we're always keeping an eye on the present while also trying to have a long view of the future in that sense. So that obviously drives a lot of where we're spending money. And then as part of that new hospital case, when you're actually designing a case of that magnitude, it's very all-encompassing. There's a huge amount of work goes into understanding what that means financially, what it means economically, what it means for the population of Harlow, and there's a great deal of endeavour and investment going on in that space at the moment. So it's a very exciting time. Looking ahead, we've got a couple of highlights I'll call out here. So the funding envelope, the way we work, it's been around for a few years now. But as I say, we've come out of this pandemic where it is now what is the new normal and what does the new normal cost, and we're trying to work out what that looks like. I think it's going to be ever more challenging financially. It's been not easy, but certainly okay for a couple of years. The challenge is back in that we have to really review our efficiency and really get back to kind of some of the productivity levels that we had historically. There's a big focus on the elective recovery, as Lance alluded to. There is a big backlog that we know we're trying to serve our patients who have been waiting longer than they should have been, but that comes with balancing out the financing and the money in a new regime that we're still trying to understand. And I alluded to this need to work closer with our system partners. It really is partnership working now. Every decision we make involves a conversation I have to have with our organisation, our system partners, about what that means for them, because we're drawing down from a bigger pot rather than just our own. And then this, at the bottom, this efficiency waste reduction target is labelled as £12 million. Every year we have this thing called a CIP target. It's cost improvement programme target, but effectively the gap into which we have to try and balance our books, and that's £12 million for the current year. So it's a challenging environment, but we are really joined up. We all see why we have to do that as a trust, as an exec team. It's not for me to land the financial position, it's for all of us to land the financial position, and we'll continue to endeavour to do so and really try and maximise our pound for all the population that we serve locally. I think that is me. I think I'm handing back to... Oh no, sorry. You can obviously have a review of the annual report. Sorry, forgot about that. Everyone should print a copy out and keep it by their bedside like I do. Have a spin through and see some of the accounting treatments. But after that, I think I'm back to you, Hattie.
So I think the idea of taking that to bed each night, Tom, might well put everyone in the whole room to sleep. However, you've now had 45 minutes of us. Over to you for any questions or points that you want to make. I'm really conscious of the fact we've lost some of our external audience who've been coming and going. We seem to have had IT problems. I think they're back. I know Laura has been collecting questions and thoughts from them as we've gone through. So let's begin within the room. Do we have anything that anybody wants to bravely be the first person? Right, then Anne. Thank you, Anne. Stay sitting, Anne. Don't stand up. You have indeed.
Thank you. My first question really is for Lance and for Michael. Has any progress been made that you can reveal to the public on the new hospital?
Let's let Michael have a go first, because Lance has been talking a lot already, so let's let Michael have a go.
Thanks, Anne, and a really good question. So yeah, we've made some really good progress on the new hospital. We continue to work well with the national team. You'll know that there's a new hospital programme that's driving the development of 40 new hospitals. We're still in the first cohort, one of the first cohorts of hospitals to be designed and developed. We're working really closely with the national team to develop what's called Hospital 1.0, which is their standardised hospital design. And we're expecting an announcement in the next couple of months around the next stages of the business case to develop all of the 40 hospitals. That's expected to go to Treasury this month, and the announcement around the rollout of the hospital programme in December. So we continue to engage the public. So we've got a website, national website. So the question was, how will we let the public know on our progress? So we've got a website which we update regularly, and we keep the public informed of the progress of our new hospital on that website. It's free to everybody. I don't know the address, but I will let you have that. We'll put it in with the papers. So we do keep the public informed. We update at the public board meetings as well regularly on the progress on the new hospital.
Lance, do you want to add at all, or are you?
That's
No.
good, thank you.
No. So, Anne, I think you've got some other questions as well. Do you want to do them all at once?
Yes.
Why not? Well, there are no hands up, so you might as well grab the floor.
Hey, I think this one's for Steph, if she's here. Can you advise us how many people have been waiting over a year for routine services, and what are you doing to reduce the waiting list?
So, Michael's going to stand up again? No, Lance is going to stand up. There's much more. I was thinking, goodness me.
Yeah, thanks, Anne. So I think, well, I've referred to that in the presentation I was given earlier. So for memory, I think we've now got about 1,800 patients who've been waiting for more than a year for elective surgery. The 78-week target's about 260, I think it is. And we haven't got anyone who's been waiting more than 104 weeks. So given where we were 6 months ago, that's remarkable achievement, but we still have nearly 2,000 people waiting more than a year. And pre-pandemic, for many, many, many years, I think maybe 6 or 7 years, we didn't have any patients who'd ever waited more than a year. So that shows you the scale of the impact that COVID's had. In terms of what we're doing about it, so we're currently running at just under 100%. We've had a couple of months of just over, between 100 and 120% worth of activity relative to pre-pandemic levels. Obviously, we need to go faster than 100% to be able to pull the excesses down. We're operating on lots of patients through our own physical capacity, and the surgical teams in particular, because most of it relates to surgery, are working extremely hard to fill both our inpatient and our day surgery activity up. We're also working with the private sector, and we're also working with third-party companies as well to ensure that our patients can get as speedier access as possible. But it is going to take a good couple of years before we can get back to pre-pandemic levels.
But I think Lance is being very modest. One of the things that gives me enormous pleasure is on Friday afternoons we get a circular email which compares our performance against every other acute hospital in the Eastern region, and we very often come out top in terms of our elective recovery. So we are doing seriously well, Anne, and I'm very proud of what we've done in bringing those numbers down. Want another one? Off you go then.
This is one which is quite close to a lot of patients' hearts, and that is, do you have plans to reopen the restaurant to the public?
So I've been asked to stand up so you can be seen on camera. So it's we do recognise the impact that we've had closing the restaurants to patients and to the public, particularly to carers within the organisation. It was a requirement during COVID to manage the infection control through the organisation, but it is really important to us that we do have an offer that meets the needs of all of our patients and of the public. So through our senior leadership team meetings, we agreed this month that we would be reopening the restaurant to the public. We're expecting to do that at the end of the month, beginning of next month. So we're just working through the logistics of that because obviously it has a massive impact. But yes, we do plan to reopen the restaurant to patients and to the public.
You heard both myself and Lance talk about the impact Anne has on us very often. You've just seen evidence of it in her questions, none of which let us off the hook lightly. Laura, have you got some questions from? Then we'll have one more go. Questions from the audience? One of you must be brave enough to. Yep, brilliant.
Yeah, you've said about the waiting time for surgeries. What about outpatient appointments? Because at the moment, a family member is waiting for an outpatient appointment. He's on a waiting list for an appointment, not to wait for the appointment because there is such a backlog. And the timescale shown on your website seem to bear no resemblance to what outpatient appointments are.
Lance, do you want to?
Thank you. Yeah. So again, apologies is the first thing to say for long waits. It will depend. We can catch up afterwards if it's helpful. It will depend on the specialty and the urgency. We do have long waits for some routine outpatient appointments as well. We're working really hard to bring our cancer down, importantly, and the urgent appointments down, and have made really, really good progress on that, and now hitting our 2-week wait referral cancer times, which has taken us a while to get there, but we're now hitting those, and we're now nearly achieving our 62-day cancer appointments. Some routine outpatients, particularly routine outpatients for surgical procedures, are longer than we would like them to be. Every patient should be getting a review. It'd be interesting to catch up with the officers to check this is happening. Should be getting a regular review by the senior clinician, both a paper-based review but also a telephone quick review to check the urgency and whether the urgency has changed or not. And if the urgency, as it does in some conditions, if the urgency changes, then we're bringing those forward as quickly as possible. As I was saying, in terms of we're trying to use technology as much as possible in terms of providing opportunities for virtual outpatient appointments, because that enables us to see more patients more quickly, but also prevents patients having to travel onto the site. So we're ratcheting that up as quickly as we can so that we can get our waiting times down as quickly as possible. And we've also just implemented, not quite in every specialty yet, but in many, something called patient-initiated follow-ups, and I think we've got about 2% or so of our follow-ups, but it's 2% of about 350,000 a year, so it's quite a big number, where we're enabling patients to initiate any follow-up appointment that they need into the future, again, to be much more beneficial for the patients, but importantly, to free up some capacity in our clinic so that we can, again, continue to reduce our outpatient waits. So apologies, I'm more than happy to catch up with you afterwards and get any specific details, and we can have a look into the specific, your specific relative, I think you said it was, relative issues much more, but we're doing everything we can to bring those weights down as well.
Thank you, Lance. Laura.
Okay, so this is for our virtual audience. An apology for those that have lost connection. The broadcast was clear, but sadly, I think the size of the broadcast, including the slide deck, made it quite difficult for some home Wi-Fis, and I know how frustrating that is. So the recording will be sent to everyone as a link by the end of the day. So our apologies.
Thank you for that, Laura. Anything else that anybody wants to... Oh, we've got two, so I'll let Anne in a second. You go first.
Just personally, but also as a newcomer, I've noticed that we have quite a few services that we have sent out outside of the organisation, including things like training that we used to do in-house. Just wondered where we were with regards to the potential to train up those who are interested as a way of improving the opportunities for staff here and encouraging them to stay, in order to help us stop kind of sending things that we could do in-house out to other companies and facilities, and therefore overall saving us money, but also improving staff opportunities.
So if I respond quickly and then maybe hand over to Getch in terms of any oversight from the team. So we have also invested really heavily in our organisational development team, and there's one of the most amazing people sitting behind you who's really driving our own offering internally really hard. We've invested a lot of time and money and effort to support overseas nurses, our overseas nurses as well, and we've got another fantastic colleague behind you who's really supported that, and the drive around OSCEs and supporting our overseas nurses and passing their OSCEs. And then the third step to that was create a suitable environment and facility such as the Learning and Education Centre in which we can provide that care. So we have over time used third parties to support our training and education. My personal view is I think we're in a really, really strong place now. We offer way more than we've ever done in the 5+ years that I've been here, and not only in terms of breadth, but in terms of quality and depth and scope of training, both from a core clinical training as well as management training, leadership development training, etc., as well as the obvious things that happen all the time in terms of supporting all of our medical staff or doctors in training, our nursing colleagues and our AHPs and scientists in terms of their normal workplace program. So we're getting there, I think. Is there anything else, Getch, that you'd like to add?
Hi, just stand up, take my own advice. Getch Uradi, Director of People. Thanks, Aneka, for the question. Just to add what Lance has said, we're absolutely fully cited on the fact that if we can train our people, it will help to not only attract people, but to retain people and actually make people who are working in our organisation give of their best. And therefore, training and development is absolutely pivotal to what we do. Lance has alluded to, we've got a relatively new Associate Director of OD and Learning, and we're really investing heavily on our education on site. And one of the things that we are currently working on is just reviewing all of our training, because if we can provide it ourselves, why wouldn't we do that and only invest in third parties where we can't deliver it, either because of size or scale or the particular course itself. But I also want to put another plug around apprenticeships as well, which is another way of learning, and it can be at all levels and throughout anybody's career, so a big plea for that. And then the final thing to say is all that information is on our AlexNet, and we really want to hear from other people. If we're not covering what you would like us to do, then absolutely please come to me or Mandy's team or anybody in the people team, and we'll absolutely look at it.
Thank you. And Anne, you also had a hand up.
Thank you. As a prompt from the gentleman that mentioned outpatients, one of the biggest problems that you've got at the moment and causing a lot of frustration for patients and the public is being unable to get through to change appointments, make appointments. You can sit on the phone for over an hour. That's common now. Just recently I noticed when I tried to ring through it late in the evening, which I thought would be a easy time, there's now a telephone message which says there's a big volume of calls, please call back again, and you get cut off immediately. Is there some way that you can improve the system? It may, I don't know whether it's more staff or whether via technology it could be that they receive a message saying please leave your number and we will call you back. And I've noticed one GP surgery in the town now has that facility. Is there something we can do to stop the stress and the frustration for patients that phone through?
So the easy answer is yes, of course, and we can always do more. So we've put in a I think is much better telephone system and digital system in terms of being able to get through to the hospital generally, but we also recognise that that's had some problems. We also recognise that the ways that we've changed our working hasn't particularly helped with contact for things like changing an outpatient appointment. And so I see every formal complaint that comes into the organisation, and a lot of them in recent months have been about our inability to be as responsive as we could be in our communication to our patients. So we're aware of it. I know that we're trying to find some IT solutions as well as trying to find some digital and better solutions to be able to support our patients more effectively. So yes, I understand it. Apologies to you, apologies to others if we haven't got it right, or when we haven't got it right, because we know we haven't got it right, and we'll continue to enhance that. It's not to do with additional staff, it's to do with how we organise ourselves and our processes and make sure that we've got the right people who've got right access to the right information. The other thing that will really, really help into the future, although it is a year plus away, is having a really high quality electronic health record, which is another reason why we're investing in that, so that you've got much easier access to all of the patient information, and we've got much easier access to be able to move that information between the patient and their primary care team, for example, and then we've got much better ability to be able to send the right information to patients via text, via email, via whichever, as well as letter, whichever means would support them, but that's a little while away, and we're trying to find an interim solution to be able to manage it more effectively.
Right, one last call. Any final questions, anyone? then it falls to me to say a massive thank you, both online and in the room, for coming along. I hope you've learnt something. You've had an awful lot of information thrown at you, but I hope it's been a good time, and lunch was fabulous. So thank you very much to all the catering staff for doing the lunch. And that's it, we're done. Thank you, everyone.